Namaste and good afternoon. Welcome to the Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. As you know, Apollo Hospitals has been always at the forefront in creating health awareness. And with our live sessions on Facebook, we have been bringing to you authentic information on diseases, conditions, path-breaking treatments, latest technologies, and medical innovations. These days, we often hear or read about heart attacks in young people. We also read about youngsters having cardiac arrests, which always shocks and dismays us. But it is more important to understand why the prevalence of heart attacks among young people has been increasing over the last few decades and how to address the problem. You may be aware that a heart attack is also called a myocardial infarction, and it happens when the blood flow to the heart is partially or fully restricted. Heart is unable to get the blood supply and the oxygen that it needs. It can't pump properly, and then it gets damaged. Heart attacks are medical emergencies, and early treatment is critical. A heart healthy lifestyle is even more critical in preventing heart attacks, and you should be aware of these strategies. To explain to us as to why heart attacks are on the rise, and especially in younger people today, and discuss ways to mitigate these risk factors, I welcome Dr. Mukesh Goel, Senior Consultant, Cardiothoracic Surgery, Heart and Lung Transplant, LVAD and ECMO at Indraprastha Apollo Hospitals, New Delhi. Dr. Goel has the distinction of having carried out more than 3,000 heart surgeries, the first heart transplant at Apollo Hospitals, the first heart transplant in the youngest child in Asia, and he's also extremely experienced in beating heart bypass surgeries, heart valve replacement and repair, aortic surgery for aneurysm and dissection, LVAD, ECMO, minimally invasive cardiac surgery, robotic assisted CABG, and many more. Dr. Goel did his MCH in Cardiothoracic and Vascular Surgery from GB Pant Hospital, Delhi University, his MS in General Surgery, and his MBBS from the Postgraduate Institute, Rohtak. He's part of many professional associations, like he's a fellow of the Indian Association of Cardiothoracic and Vascular Surgeons, life member, European Association of Cardiothoracic and Vascular Surgeons, international member, Society of Thoracic Surgeons, US. Welcome, Dr. Goel, to this Facebook Live session. Thank you so much for giving us your time and joining us. And we look forward to a very insightful session from you. So let's first of all begin by asking you, how do you recognize a heart attack? What really happens?
Very good evening and namaskar, Dr. Srinidhi and my audience. Like the heart attack produces very typical symptoms in patients. There is sweating, there is chest discomfort. And the person feels that there is something like very heavy lying on the chest. It is like they might feel that some elephant it has sat on a chest, or somebody has put a very like a large boulder on their chest. And they might feel that they are not able to breathe, and they are quite anxious and sweating profusely. So these are the symptoms that there might be something going with the heart, and the person is suffering with a heart attack. Another very common symptom which we see nowadays, which was not typically described or present earlier, is sudden onset of acidity-like symptoms. That there is sore eructation, and the person is feeling that he's having a lot of gas in the abdomen, and it has suddenly developed. And he is not like many people, they suffer with this gastric problem and acidity and sore eructations and gaseous distension of the abdomen whole their life. But the person who is feeling it for the first time, that he is continuously having burping or sore eructation, so the heart attack should be ruled out.
So what are the common risk factors for heart attacks?
So heart attack, risk factor for heart attack, we can put into two categories. One are native risk factor, innate risk factors, and which we cannot control. They are not in our hands. So one is a positive family history for heart disease, like if first degree blood relatives like mother, father, brother, and sister, who are like related by blood to you. So they get a heart disease at an early age, like 50 or below. Then the person is also at increased risk of developing heart disease and heart attack. Second, with age, like men over 40, men over 50 and men over 45 and women over 55. So because it is an age-related disease, so as you get older, you have more probability of suffering with heart disease and subsequently heart attack. So these are the two factors which are not in our control. So these are called innate risk factors and uncontrollable risk factors. The rest of the risk factors, which we call environmental risk factors, which happen because of our lifestyle choices, and which we can control. So what are those risk factors? One is high blood cholesterol, another is smoking, third is diabetes, uncontrolled diabetes, fourth is high blood pressure or hypertension, sedentary lifestyle, and stressful personality. So these are the factors which probably and obesity over.
So, is it true that heart attacks and generally these kind of uh, high risk situations develop are now seen more in younger people? Because earlier, it was always considered that, over the age of 50 or 60, but we do hear of cases of heart attacks in the young. So, is this really a prevalent phenomenon? Are they on the rise?
So, Dr. Shirinidhi, one factor we see that increase incidence of heart disease in younger population is one more awareness. Now we are more aware that if a younger person comes with these kind of symptoms, earlier we used to label it as maybe because of the muscle related chest pain or other thing or non-cardiac. But now we are more aware that cardiac disease can very well be present in younger population and we are looking for it. Second, definitely, as we were talking about lifestyle risk factors and the choices. So there is a sedentary lifestyle which is increasing in younger population. Smoking incidence is increasing. Our diet has drastically changed from the traditional diet which we used to take earlier. And the children and young population, they are more sedentary now. And there is a very little outdoor activity, sports or otherwise. And stress of life, studies, and job, it is increasing day by day. So all these factors they are leading to increased incidence of heart disease in younger population.
So we already said that diabetes and hypertension are risk factors for heart disease. So is it also that one finds diabetes in the younger population now? And could you give us some insights on how this can be prevented, perhaps?
So,
Diabetes and
Dr.
hypertension.
Srinidhi, as such, incidence of diabetes in younger population is not increasing.
Not increase.
Okay, because diabetes generally the people are diagnosed at like 40 or 45 years of age, and then they start, and the same age when they first of all they are detected also having hypertension. But what is happening in younger population if you talk about heart disease? The more important risk factors are smoking and sedentary lifestyle and stress. These are the factors which are more prevalent and more increasing incidence of heart disease in younger population. And 40 and beyond, definitely, then diabetes and hypertension they become important.
So let's talk a little more about the smoking habit because it is prevalent. It is a risk factor not only for heart attacks or heart disease, but for so many other conditions as well. So, how does smoking cigarettes and also this current practice of vaping, e-cigarettes, how do they impact the heart? How do they pose a risk for heart attacks?
So, what we say that even a single cigarette, it can lead to increased incidence of heart disease. Even one cigarette is harmful for anyone. You cannot say that, okay, I smoke occasionally. And smoking has like two-way effect. One is the whole smoke which we inhale, so it causes inflammation and injury to our airways and other membranes. And second, the a cigarette has around 2,000 chemicals which are released in the blood when we smoke. And many of these chemical compounds, they lead to atherosclerotic plaque formation, increase in cholesterol, and inflammatory reaction in the blood, which causes deposition of cholesterol and calcium into the arteries, leading to atherosclerotic plaque and heart disease and other like peripheral vascular disease and kidney disease and even stroke. All these things.
Another aspect is this substance abuse. So, do these drugs and other substances that are abused, do they also increase, apart from impacting the health, do they affect the heart as well?
So there are two kinds of substance which are basically abused. One are we call heroin or weed or marijuana, which cause depression of the central nervous system and a feeling of sedation and sleepiness. And then there are substances which are stimulant like MDMA, meth, crystal meth, or amphetamine. So what they do, they increase secretion of adrenaline, amphetamines in the blood, and the person feels very energetic, very exciting. So it causes a acute increase in the blood pressure, constriction of the blood vessels in the body as well as in the heart, decrease in the blood supply to the heart muscle, and hypercontractility of the heart muscle. So all these factors, they can lead to even a heart attack and sudden cardiac arrest also.
So, does alcohol also have the same effect?
So alcohol does not, alcohol, otherwise what alcohol does is causes somewhat of a relaxation of the coronary arteries, which are arteries which are supplying blood to the heart. So in a way, it might increase blood supply to the heart muscle. But what alcohol causes, that alcohol is metabolically not good for the body. And all these factors like liver disease and cholesterol and calcium, so they are all multiplied because of that if the person takes alcohol regularly, though in a more than moderate amount. Up to mild amount or moderate amount, it is still acceptable.
So, here we have an interplay of stress, smoking, uh, say, a bad diet,
Abuse,
as like there is also this alcohol, everything put together. Do they have a kind of a do they enhance each other's effects? Do they have a kind of a combined at increased risk that they pose for heart disease? Because some of these things often happen together in young people.
Yeah, Srinidhi, that is a very good question in a way that risk factor for heart disease, they do not act like adding their effect to each other. They are basically multiply each other's effect.
Yeah.
So it is 3 plus 3, not 6. It is 3 plus 9. So that's why if a person has single risk factor, the effect might be maybe 5%. And if he has a 2 risk factor, it is not 10%. It becomes 15-20% increased probability. So that's why we should have to actively look for the risk factor present in us and have to actively work towards reducing our risk.
So when you say actively look for the risk factors, normally we associate annual health checks. We generally these kind of screenings. These all, there is a tendency to believe that this is all to be done only after the age of 45 or so. So what would your advice be to youngsters, or at what age should one typically start thinking about these things, or getting your sugars measured or your BP checked, or go in for an ECG or an echo? So when do you think all this should start?
So I will advise like first general check should be done before age of 20. And if everything is normal, if everything is normal, so then maybe at 25, then 30, But after 30, we should make it an annual checkup.
Yeah. Also, if they if once they undergo the health check and they find that they have some already some risk factors, what are the lifestyle measures that, apart from, of course, avoiding the harmful substances, what other proactive measures can somebody take at a young age, so that they don't develop this tendency to develop myocardial infarction or develop other heart problems later? For example, even if they find that they have a genetic propensity for it, or if their cholesterol is high. So once the screening is over, what should they do next?
So, first of all, I would like to request everybody that lifestyle change and modification of lifestyle is not it should not be that okay, we have got some problem in our animal check and now we should do it. It should be habit whether there are any risk factors or not. Second, definitely, if there are risk factors and which are detected during annual checkup, then obviously it becomes even more important. So what we are talking about here, what are the lifestyle or choices or changes which we should keep in mind to have a healthy life and keep and prevent heart disease to the maximum extent it is possible. So first of all, we should be like, what is our diet? So our diet should be a basic principle is that it should be a moderate and it should be a combination of everything. A combination of cereals, multigrain cereals, fiber, and 2 to 3 servings of fresh vegetable and fruit every day. Then limited amount of dairy and meat and salt. So these are the general meal plan one should keep in mind. Second is a regular physical activity. A 30 to 40 minutes of good cardiorespiratory exercise, walking, swimming, cycling, anything is okay. As it is like if you do it regularly, at least 5 to 6 days a week, then it is okay. You don't need any like expensive or sophisticated equipment or gym membership to carry out this. Third is avoidance of smoking and more than moderate amount of alcohol. So, what is moderate amount of alcohol which we say can be acceptable? It is 1 drink per day for women and 1 to 2 drinks per day for men, not more than 4 days a week. That is the maximum limit which is allowed. Then uh, annual check so that we can detect whether there is any diabetes, any blood pressure, any high cholesterol, and we have to take appropriate medication for that.
You were speaking about exercise. Now, on and off, we do read in the media about people who developed cardiac arrest while exercising in the gym. So, is there a concept of over exercising, and is that also a risk factor, or is just coincidental?
So, over exercising, what we call, or just stressing your body, though it is not itself a cause of heart disease and development of heart disease, but if somebody is having some plaque lying there, which is otherwise asymptomatic, so what can happen that during at the time of extreme stress, which can be any kind of a stress, even emotional stress can lead to that. And obviously, when we are stressing our body in the gym, so it's a huge stress on the system. So sometimes what happens that that flat can rupture, and there is a clot formation of that place, shutting down blood supply to that portion of the heart, leading to a massive heart attack and cardiac arrest. So we should not overexert or overstress our body.
So, coming to actually, if somebody is having a heart attack, a youngster, so you already explained some of the symptoms that can happen. So, what should be the immediate emergency response?
So the emergency response is first of all just sit down or lie down wherever you are, whether you are in office, whether you are at home, or whether you are in gym, and tell your colleague whosoever is present around you that I feel that I am having a heart attack. So please call an ambulance or take me to a nearest hospital if it is possible. Otherwise, never try to drive yourself to the nearest medical facility and tell the person that I feel that I am having a heart attack, I am having these symptoms, so that immediate ECG can be taken and one blood test must be called tropi to diagnose acute heart attacks. So the results are available within 5 minutes. So these can be carried out and heart attack can be ruled out. But one should just lie down and relax and don't panic.
Right. Um, so once the person is in the hospital, could you give us a brief outline of what would be the emergency treatment that is usually given for heart attacks, and uh, what are the treatments that are actually, what is the treatment process?
So once the hospital has established a diagnosis of heart attack by doing a simple ECG and a blood test, then if the hospital is equipped with handling heart attack patients, so the hospital will definitely start the treatment. Otherwise, the hospital is not equipped for handling heart attack patients, then the hospital should refer that patient immediately to nearest facility with the institution with the facility for treating heart attack patients. So there are two kinds of treatment which are available for acute heart attack. One is what we call primary angioplasty. Here, the person is immediately shifted to the cath lab, where the angiography of the heart vessels is carried out, and the blockage which is causing the heart attack, it is dilated with a balloon and a stent is implanted at that place to re-establish the blood flow. So that is called primary angioplasty. And the facilities where primary angioplasty cannot be carried out. So then what we do, we give clot buster drugs for dissolving that blood clot which is causing the heart attack. It is called thrombolysis. So that therapy can be given.
So finally, I just wanted to ask you, if somebody is young and has survived a heart attack, what would be their lifestyle to be followed? What precautions should they follow? Should they be very cautious about exercising or their diet? So what should be the measures that they should take?
So it is not prohibited to do exercise after the heart attack. After the person recovers from the effect of heart attack in 3 to 4 weeks, then we advise the person to slowly start exercises and reach to like 30 to 40 minutes a day and slowly build it up. And obviously, he has to stop overexertion anytime, not only during exercise but otherwise also. And diet, as we have discussed, it should be moderate. It should contain variable amount of multigrain cereals, fresh fruits, vegetable, limited amount of dairy and white meat. And as far as fat and salt, it should be very limited in quantity. Then smoking is a big no. Never. Alcohol should be limited, not prohibited altogether. And meditation is a very good for relaxation of body and mind, and it benefits heart also. And then a regular checkup for diabetes, blood pressure, and cholesterol. And they should be like the person has to take medicine for if there is anything he requires.
So thank you so much, Dr. Mukesh Goel, for this wonderful discussion. So viewers, I hope that you found this session insightful, and there were many valuable suggestions given by the doctor, which basically means that heart disease and heart attacks are dangerous, but you can prevent them in many cases. So do remember all the lifestyle changes about exercise, diet, maintaining a healthy weight, reducing stress in your life, stopping smoking, drinking in moderation, getting those annual physical exams, and also know what the warning signs are for heart attack or a stroke or any of these medical emergencies, so that you can do the right thing and seek medical help immediately. Living a healthy lifestyle is one of the most effective ways you can prevent all these non-communicable diseases. It is a priority So whether you're in your 20s or your 30s or your 40s, it is always a priority, and it's good to know what to do so that you can live your healthiest life. So you know that we are available across the country and on all the digital social media channels to assist you at any time. So do reach out to us for further clarifications or put in your comments or queries on any of our social media channels, and we're always there to assist and support you. Thank you. Stay safe and healthy. Namaste.